This presentation provides a community analysis of Orlando, Florida, written by Tiffany Anderson. Topics that will be discussed during this presentation include a historical overview of the city, an analysis of community structure, population, adequacy and availability of health-related resources, the environment, government and public policy, and identification of community needs. The city of Orlando originated in 1838 during the peak of the Seminole Wars and was known as Fort Gatlin, built by the United States Army to protect settlers from Indian attacks. A small community grew around Fort Gatlin and was renamed Jernigan in 1840, after the family who established the first permanent settlement in the area. As the settlement expanded northward, the name was changed to Orlando, and by 1875 had 85 inhabitants. In 1873, a large sinkhole formed in the heart of what is now downtown Orlando, creating today's famous Lake Eola, which became a public park in 1888. In the 19th century, Orlando was known for its citrus industry, which then became a tourism industry in the 20th century, with multiple theme parks and attractions that have grown and expanded over the years. Today, at approximately 94 square miles in size, the city of Orlando has now become a global leader in innovation economy. Housing in Orlando ranges from multi-million-dollar homes and condos to middle-class housing and apartments to low-income housing located primarily around the outskirts of the downtown area. The Orlando Housing Authority provides assistance to low-income populations through Section 8 and public housing programs. Additionally, the city has several homeless shelters and coalitions to help the approximately 1,600 homeless individuals living in the area. The City of Orlando provides multiple public elementary, middle, and high schools, as well as several private schools. The city is also home to the University of Central Florida, which is the largest public university in the nation, as well as Valencia Community College and Rollins College, which is a private institution. There are also several satellite campuses for schools such as the University of Florida and Berry School of Law, not to mention multiple technical college locations. Additionally, Orlando provides multiple public library locations providing books, audiobooks, entertainment videos and DVDs, and recorded music, as well as public computers with internet access and online reference resources. The library provides over 130 classes per month, teaching the use of PC and Mac computers and weekly storytime readings for children of different ages. There are also multiple community centers that have wide ranges of activities and events for persons of all ages, including fitness centers, athletic clubs, after-school programs, day camps, and much more. Prices to participate in the different options vary from center to center and activity to activity. The City of Orlando currently has a population of 277,173, with a population density of 2,327 persons per square mile. 68.7% of these people are between the ages of 18 and 64, which can be attributed to the large college student population as well as the working class population. Less than half of the city's population is white or Caucasian at 40.5% and has been decreasing over the past several years, which in turn increases the city's diversity and need for cultural awareness. The current unemployment rate is 7.6%, which has decreased, although approximately 20% of Orlando's population lives below the poverty line, which leads to an increase in health disparities such as difficulty obtaining adequate health care and preventative treatment, and an inability to afford acceptable living conditions. Predominant health concerns in the city of Orlando include diabetes, heart disease, obesity, sexually transmitted diseases, and substance abuse. The leading cause of death in Orlando is cancer. Diabetes and heart disease are among the most chronic conditions in the United States, with obesity being a major contributing factor. Prevention and intervention for these conditions includes education on diet, exercise, and personal accountability. Types of cancer in the Orlando area vary from skin cancer to lung cancer, colon cancer, breast cancer, and beyond. Major contributors in these areas are exposure to the Florida sun during outside activities such as swimming and visiting the beach, and smoking. Two other health concerns include prevalence of sexually transmitted diseases and substance abuse, which can be associated with a large student population, the 20% living below poverty, and the small number of city residents holding a bachelor's degree or higher, which indicates potential lack of education. Hepatitis C is currently the most prevalent communicable disease in Orlando. Hepatitis C is a liver disease that is transmitted when the blood from an infected person enters the body of someone who is not infected through sources such as sharing needles or other equipment like drug paraphernalia, tattoo parlor instruments, sharp household instruments such as razors, and contaminated blood transfusions or organ transplants. Providing education about the prevention of spreading and contracting hepatitis C is essential to reducing the prevalence of the disease in the Orlando area. The City of Orlando has multiple hospitals available to its residents, including Orlando Regional Medical Center, Winnie Palmer Hospital, Arnold Palmer Hospital, several locations for Florida Hospital, and a couple of VA locations. There are also various walk-in clinics throughout the city provided by Florida Hospital, privately owned clinics, or those found in locations such as Walgreens and CVS. Additionally, Orlando has numerous nursing homes and assisted living facilities spread across the city with varying levels of care, including in-home care services, depending on the financial and healthcare needs of the patient and family. Objectives set forth by Healthy People 2020 that coincide with Orlando's major health concerns include reducing the overall cancer death rate, reducing the annual number of new cases of diagnosed diabetes, and reducing coronary heart disease-related deaths. Achieving these goals involves not only recognition of the problem, but establishment and incorporation of appropriate interventions, such as providing adequate education about the diseases and ways to prevent, manage, and even reverse them. It also requires providing sufficient access to such education and healthcare. Important disparities related to failure of meeting these goals includes lack of healthcare coverage and low socioeconomic status. Reducing the overall cancer death rate can be directly linked to promoting evidence-based screening and reducing risk factors such as use of tobacco products, physical inactivity and poor nutrition, obesity, and sun exposure. Others can be prevented through vaccines such as human papillomavirus or HPV and hepatitis B. Lifestyle changes have also been proven effective in preventing or delaying the onset of type 2 diabetes in those who are high risk. Heart disease remains the leading cause of death in the United States and is also amongst the most preventable of diseases through control of modifiable risk factors such as hypertension, high cholesterol, smoking, diabetes, unhealthy diet and inactivity, and obesity. Control of these risk factors requires access to education, availability of healthy foods, opportunities for physical activity in safe, walkable communities, quality of working conditions, and access to affordable quality health care. The City of Orlando is home to a plethora of parks and recreation areas, both small and large, public and private, state-owned. These areas include activities such as walking nature trails, fishing, kayaking, sports, and camping. Environmental safety is provided by the services of the Orlando Police Department, which has over 700 sworn officers and 100 civilian employees, as well as the Orlando Fire Rescue with 17 fire stations and the city's emergency medical services, as well as Orange County Animal Control Services. Despite seemingly adequate safety provisions from large forces, crime rates in Orlando continue to be higher than the national average. An additional environmental concern is the underutilization of public transportation and carpooling, which leads to heavy noise and traffic pollution throughout the city. The City of Orlando has a mayor-commissioner form of government with 6 commissioner districts. Both the mayor and the commissioners serve 4-year terms and meet twice a month. There are 8 city departments that cover public services, including law enforcement and fire protection, public works projects, parks, and entertainment venues. Council meetings are posted online and are always televised or available to watch online as well. Council minutes are also made available after the meetings are held. Combining the Windshield Survey with research on Orlando's community needs, it has been determined that the areas most in need, aside from previously discussed health concerns and diseases, include higher education levels, increased mental health resources, improved health literacy and chronic disease management, reduction in motor vehicle collisions, and better access to healthcare resources. Despite there being multiple college locations throughout the city, currently only about 34% of Orlando's population is considered to be a college graduate with an associate's or bachelor's degree. Lack of education contributes to reduced health literacy and consequently disease prevention and management. Mental health resources in the community and in the state are limited. There are approximately 660,000 adults and 181,000 children living with serious mental illness in the state of Florida. And approximately 70% of them are not able to get the treatment they need. In 2017, Florida was the second lowest state in per capita spending on mental health. About $718 million per year goes into mental health programs, yet nearly $1 billion goes into jails and prisons for housing and medicating mentally ill inmates. While insurance companies and larger businesses have attempted to improve access to mental health treatment through increased insurance coverage and provision of employee assistance programs, the ongoing problem remains. In 2017, there were a total of almost 32,000 car accidents alone in the Orlando metropolitan and Central Florida areas, resulting in almost 23,000 injuries and over 200 deaths. Lack of public transportation utilization and carpooling results in increased traffic conditions during high commute times, increasing the likelihood of traffic accidents. Despite the presence of alternate routes to and from major business areas, costs of tolls as well as time contribute to increased traffic along specific direct routes. Finally, despite the multitude of locations that provide healthcare in the city of Orlando, access to and utilization of healthcare remains a top community issue. Disparities include lack of insurance, inability to pay for healthcare costs with or without insurance due to increased poverty levels, and lack of education, which leads people to believe that because they feel fine, they don't need to seek out preventative healthcare treatments.